Hello everyone, welcome back to the Eat, Burn, Sleep podcast. Today we're going to have a conversation that's going to interest a lot of women, but also a lot of men who want to understand women better. I'm with Dr. Nikita Grover, who's a functional medicine doctor. She's based at the Lancerhof Clinic on Dover Street in London, and we met, and every time we talk, it goes on and on and on. And I've asked her a million questions about women's health, about weight management, about hormonal issues, about cortisol, about perimenopause, and so on. So I'm going to give you a little bit of background about Nikita. Nikita, first and foremost, thank you so much for being with us here today.
Thank you for having me. It's a pleasure.
So Dr. Nikita Grover is an experienced GP. She's passionate about helping patients optimize their health and prevent illness. She's qualified in medicine from University College of London, UCL, with an additional intercalated honours degree in history of medicine and history of art, which I love because I studied history of art in my spare time, and I find it fantastic that you studied the history of medicine. I actually started taking huge interest in the work of Avicenna.
Yes.
So we can talk about that. So after several years in hospital medicine, Nikki obtained postgraduate qualifications with distinction in child health, dermatology, and obstetrics and gynecology before adopting a career in GP practice, general practice, where she has worked for over 25 years. She is a member of the Royal College of Physicians and Royal College of General Practitioners. She's been a postgraduate GP trainer and has lectured UCL medical undergraduates in culinary medicine. So she takes a big interest in food, obviously. Dr. Grover also works as head of functional medicine at Lancerhof London and is a certified member of both the US Institute of Functional Medicine and the Austrian Society of Mayor Doctors, focusing on the interaction of diet and lifestyle on the root causes of illness where conventional medicine has reached its limits. Dr. Grover combines conventional and functional medicine, an approach that is compassionate, honest, and empowering. So I'm going to call you Nikki, if that's okay.
Please do.
I have, so many questions for you, but your bio is really interesting, really diverse. You're clearly a very intelligent woman with high qualifications, amazing experience. I want to understand a little more how you differ from a traditional GP. What does functional medicine bring to the table for a patient?
That's a very good question. It's interesting hearing you talking about my bio because I read it as someone that was struggling to find what it is they wanted to do within medicine. And I sort of experienced many specialties. I wanted to know a little bit more about each of them, so did qualifications in all of them, but nothing was really satisfying that desire to know more. And I guess it was only when I found functional medicine that everything started to make sense. I began to realise that true medicine was about finding the root cause. And until I'd studied functional medicine, that wasn't happening. And the sort of observations I was making over the last maybe 10 or 15 years were that people were coming in to see me and they were having problems that I couldn't solve. And it was as though the number of tools I had in my toolbox were very limited. And, if you've only got a screwdriver in your toolbox, everything looks like a screw, but, nothing was working. So people would be going out with a prescription and then coming back the next day, and there was this sort of revolving door of patients coming in and out just with prescriptions. I didn't really feel that I was satisfying what it was that they needed. What functional medicine has offered is really a way of understanding why a patient is unwell, whereas conventional medicine is really looking at what is the problem and where is it. So it's more about the geography of the problem rather than the underlying reasons or the process that's going on in the body that may be manifest in a lot of different regions of the body, but the process, the fundamental process is the same. And I think also it helps you understand that, health and disease are not binary. It's not just a black and white situation where you suddenly develop a disease out of nowhere. Depression isn't a deficiency of antidepressants. There has been some inflammation somewhere in the body at a cellular level, which has gradually grown and then developed into depression, if that's what the individual susceptibility is for that person. So functional medicine enabled me to have a sort of lever, a handle in being able to answer people's questions and get to the bottom of what's going on.
Wonderful. You're looking at the root cause, and that's similar to what I experienced with my issues when I was going to see 2 specialists, and I realized that actually it didn't matter what the expression of my disease was. The root cause was inflammation, and if one day it showed through the digestive system and the next day through the blood, maybe a month later it'd be through my joints, and then it could be through the skin, and it can express itself through so many different ways. And if we work on just putting plasters on the cracks in the building rather than stabilizing the foundations, cracks will continue appearing.
Absolutely. And the other thing that I find is that because we have these specialties that are regional specialties based on the anatomical areas of the body, patients often feel very fragmented. Their bodies are a neurological problem or a gastroenterological problem or a blood problem or whatever it happens to be. And what functional medicine does is help people come together to actually bring their bodies as a whole again, because that's what we're trying to do is sort of build them up and make them feel whole again.
Yeah, get back to the origin.
Get back to the origin, yeah.
That's exactly how I see my work. I'm like, we're going to repair the gut so it becomes good again to how it was originally.
I mean, I often say that, people come, to quote Mark Hyman, who's a great functional medicine, leader, he talks about people coming to him with whole lists of problems, and he takes a holistic response. And actually what we're interested in doing is putting the whole person back together again. So it's truly holistic in all senses of that, of that word.
Exactly. And this is why on the It Burns Sleep platform, often people come for one goal or health condition. So it can be because they want to lose weight, or because they have a digestive issue, or because they have depression, whatever it is. But when they send me a testimonial, they list 5, 6 things that have improved, but it's all linked. So they'll say, I don't have any more brain fog, I have amazing energy, I sleep better, my cellulite has gone. So they list all these things, but actually it all stems from the same root.
Absolutely.
So when we fix the root, everything else improves.
Yeah, completely. Absolutely.
So what kind of people do you see in your practice? What are the main health concerns that you deal with on a daily basis?
So because the medicine that I practice is very personalised, I see literally anything and everything that a patient brings. So nothing is out of bounds, but probably the most common things are those symptoms such as chronic fatigue, chronic headaches, long-term conditions such as diabetes, cardiovascular disease, issues where a patient may have been on some sort of diagnostic odyssey. They've seen various consultants. All the tests and investigations are deemed as normal, but the patient does not feel well. And I see lots of women, predominantly women at perimenopause, women with polycystic ovaries, young women in their early 20s, often who've lost their periods, a whole heap and range of different symptoms. I see a lot of men, so perhaps men that have noticed a bit more irritability, a bit of central weight gain, even though they're exercising, even though they think they're eating well, who maybe aren't putting muscle on in the same way that they used to, and feel that they've reached a bit of a rut, I'm not quite sure why. And some people that just want to come for longevity. You know, they're at the top of their game. They have everything they could want out of life, and they want to make sure that their health is as good as it can be, that they're trying to future-proof it. So a whole range of things.
It's interesting what you're saying about people who have been on a medical odyssey and they can't have a diagnosis. And I try to explain to people that the day there is a diagnosis is the day the inflammatory processes have gone so far that there are enough signs and symptoms that a doctor can put a name on it. But that between the state of optimal health and the state of diagnosis, there is a long road, and you could be in any, let's say 100 is optimal health and 0 is diagnosis, you could be hovering at 10 and you're feeling awful, but there is not a name for it.
Absolutely. And that's the great thing about functional medicine, is that now we can really look under the bonnet with these very cutting edge tests that we can do for patients, which actually are able to identify problems at a cellular level. So we can see problems and anticipate them before they actually become diseases. And I think that's one of the key things. And also we can look at conventional blood tests, for example, with a functional lens. So, you know, very often patients come to me and they say, you know, I had some blood tests done with my GP and I'm told everything is normal. And when we look at it with a functional lens, we can see, you know, their iron stores are in their boots. They have no vitamin D. You know, their B12 is very low. Maybe they're not able to process their B12 properly. So absolutely, before you get to a stage where a disease is diagnosed, there are many points along the way where functional medicine is able to pick them up before they get to that stage.
Absolutely. It's interesting you're mentioning iron, because I tend to have sometimes low iron, which can be linked to inflammation, low ferritin, which low ferritin can be a sign of having inflammatory processes. And I have lost my hair in the past, where a traditional GP will say to you, if your ferritin levels are not under 40, you don't need to take an iron supplement. But a dermatologist will tell you, if it is below 80, you will be experiencing hair loss.
Yes.
So a GP lens is not an optimal health lens.
Absolutely. The screening level in the NHS is about disease. We're looking at the diagnosis of disease, and if no disease is present, then it appears that there is, in inverted commas, nothing wrong with the individual. But we all know, we've all been there. You know, I've suffered hair loss just as, you know, as you're describing too. And we all know that we know that something's wrong, even though we're told that everything's the normal.
Exactly. And you mentioned men noticing a loss of muscle, a little bit of, you know, belly fat, not being able... I know several men who are in their 50s, they're doing intermittent fasting, they're exercising, and they can't seem to shift the weight. And do you think this is linked to low testosterone, andropause, and there should be some form of hormonal replacement therapy for men as well?
It absolutely can be linked to low testosterone, but very often before we pick the testosterone off the shelf, we've got to think about cortisol. All the hormones are interlinked. It's a whole symphony. And if you've got high cortisol on board, you're not going to make your sex hormones. The resources that you need to make hormones get diverted to making the cortisol in preference to making the sex hormones. So number one is to have a look and see what's going on with stress levels. Number two, I often find, is alcohol and detoxification mechanisms. And very often men and women actually are consuming perhaps more alcohol than is right for them at that particular age and stage of their lives. And they don't eliminate it properly from their bodies. And that can add to the seemingly low testosterone problem. And absolutely, testosterone is something that we can add in for men, but there's no such thing as a free lunch. That needs to be done with very careful consideration. There are knock-on problems with giving men testosterone. It can reduce the size of the testicles. It can make them infertile, potentially. They may need another hormone to help stimulate their own testosterone production whilst they're taking testosterone. It needs to be thought about very carefully. I think also sometimes men are deficient in certain nutrients that mean they're not making the hormones they need to in the right way. We very often do micronutrient testing just to have a look, what might be missing, what can we boost up, how can we reduce the stress levels. Let's do those root cause, big picture things first before we pick the hormones up from the shelf.
Absolutely.
And the nutrition and the diet, of course, yeah.
But it's true, cortisol, people forget that cortisol is a hormone, and that takes priority over anything else because cortisol is a hormone that saves our lives when needed.
Absolutely, absolutely. And also the hormone, I kind of see it as a sort of hierarchy. There's sort of cortisols at the top, and then we've got some precursor hormones, pregnenolone, DHEA, and then we have testosterone and cortisol further down. But the one sort of that's above the cortisol, in my view, is the oxytocin. The love hormone that everybody knows, and often we're not getting the love that we need. There may be something missing, either in a relationship with a partner, or we're on our own, or that there may be something that's missing. And I think that's a really big piece of the puzzle sometimes, is where are your hugs coming from? Where is the love coming from?
It's so true. A hug instantly lowers oxytocin, and that cancels out cortisol. That's why if someone doesn't feel good, you give them a hug, they instantly feel better. But it works when you're giving a hug to your pet, by the way. I've read studies about this.
True. Yeah, so true.
Patting a dog instantly reduces cortisol. And, elderly people who have a pet tend to live longer because they're getting that, cortisol reduction. And, of course, it's making them walk and gives them a purpose, looking after, someone else.
Absolutely.
But when it comes to women's health, I get asked a lot about my take on HRT. And I always, kind of give my opinion, but I always say that I'm not a doctor and that they should have a conversation with their doctor based on their tests, on their bone density. So what is your take on hormone replacement therapy and on bioidentical hormones?
It's a very good question. So I prescribe pretty much only bioidentical hormones. Would it be helpful just to explain the distinction?
Please.
Bioidentical hormones are hormones that are chemically identical to those that our bodies produce themselves. Now, you may have heard of body identical hormones as well being mentioned sometimes, and individuals often get confused. What's the difference between body identical and bioidentical? And actually the distinction is an artificial one based on regulation. The pharmaceutical regulation of hormones is a licensing issue. So where hormones have been licensed to be prescribed in a particular condition, they are regulated. So body identical hormones are hormones that are identical to our own, but they have been regulated and licensed. Bioidentical hormones are also identical to our own, but they have been compounded in a specialist pharmacy at doses which are not available as standard licensed hormones. And what that means is that they can be titrated either up or down depending on what an individual person needs. So, for example, the standard dose of body identical progesterone, eutregestone, which many women will recognise, is 100 milligrams. If you need more, you could have 200 milligrams or 300 milligrams. If you need less, it becomes slightly difficult. It might be that you have it twice a week, but you can't titrate it any lower than 100 milligrams in a licensed preparation. However, if you were to have a bioidentical compounded version, it can be made in any dose that lady requires. So that's the difference between body identical and bioidentical. So my take on hormones, I think that they are extremely useful and they can prevent women from giving up their jobs, burning out, losing their partners, hanging on to their sanity, hanging on to their brains, hanging on to their hearts, and hanging on to their bones. Hormones can save women's bodies effectively. So I think they're an incredibly important part of treatment in the perimenopause and menopause. We now know that they're safe. Women are often worried about blood clots, about breast cancer, and the medical profession hasn't really been terribly helpful in creating clarity around this issue because of the confusion in interpretation of some of the very big trials that looked at both body identical and non-bioidentical hormones in those particular trials. I mean, they've created a lot of confusion. But if you have estrogen prescribed through the skin, it is safe. It doesn't increase the risk of cancer. It doesn't increase the risk of blood clots. If you have estrogen as an oral tablet, that can very slightly increase the risk of blood clots. However, oral estrogen is very beneficial for improving your blood cholesterol profile. So what we would do in any given situation would be dependent on that individual person's risk factors. With regards the progesterone, again, progesterone is a great hormone for anxiety, for helping you sleep, and it's very often the hormone that dips right at the beginning when one's in the perimenopause, when you feel like you're losing your marbles, when you feel like you can't open the mail, when you feel like you get up in the morning and you really can't face work, you've had a terrible night's sleep. Progesterone is a really great hormone just to help calm that down. Just a caution, in a very, very small number of women, progesterone can cause depression. It's rare, but it does happen. And it's completely reversible. So if you stop it, those symptoms will go away. But again, it's very important to discuss a mental health history with a patient before these hormones are prescribed so that we're sure exactly how that person might respond. And again, with bioidentical hormones and with being able to compound them, we can titrate those doses of progesterone at a level where we're protecting the endometrial lining but still giving them progesterone to help cover the symptoms.
Thank you so much for this. I've always been quite baffled by so many women in their 40s who are so scared of HRT when, the risks, as you've just explained, are minimal, but can be totally fine with giving the contraceptive pill to their daughters who are producing a lot of hormones and taking hormones on top of hormones. And hormones are not bioidentical but synthetic. What is your view on that?
Firstly, the synthetic hormones are much, much stronger than HRT, and they need to be stronger in order to stop ovulation. Synthetic hormones are effectively not recognised by the body as something it produces itself, not a native product. So they're toxins at some level, and they also deplete a lot of nutrients. So we find that a lot of young women, particularly who may have been on the pill for 10, 15 years and then they want to get pregnant, when we do their micronutrients, we find that B vitamins are rock bottom. We find their zinc, their magnesium, their selenium is often very, very low. And they're wanting to get pregnant from a position of low nutrients. So we have to be really careful about that. There's a very, very small but increased risk of breast cancer with the contraceptive pill, but a reduced risk of ovarian cancer. It can cause also low mood and depression, and low libido in a lot of young women. And so, we've really got to think about what women are putting into their bodies. And the other problem with the contraceptive pill is the effect that it has on the gut. Again, because it's a toxin, we don't realise that it has a negative effect on the microbiome. It can create leaky gut. And that's probably why we're losing some of these vitamins, and probably why, because there is then a dysbiosis, we're not then getting the neurotransmitters produced by the good bacteria, and that's in turn what's affecting young women's mood. So it's really tricky. I mean, it's a very, very effective form of contraception, and we can't use HRT for contraception. So in reverse, women in the perimenopause and menopause need contraception. So if you're under 50, you need additional contraception to HRT for 2 years. And if you're over 50, you need additional contraception for a year, because the HRT, the hormones you're given, are too weak to stop you ovulating. So you might, for example, have a Mirena coil, which would give you that contraception, but not the combined pill.
That's understood. It's time for a little break. Hey everyone, I hope you're enjoying today's podcast. A reminder to all our listeners to subscribe, rate and share this podcast with your friends and anyone who might enjoy listening to it. We also have a discount code for all our podcast listeners, which I will be sharing at the end. Keep listening, and I hope you enjoy the rest of this episode. And what other contraception methods would be healthier? Using a temperature tracking device? You have quite a few apps that allow you to measure.
You could do that, or use condoms. The mini pill, so this is it is a synthetic progesterone, but it's in very small dose. The Mirena IUD, again, is a very effective form of contraception. It gives you the amount of progesterone that you need locally, just at the level of the uterus. So it prevents the endometrial lining from proliferating. It is a synthetic progestogen, but as I say, the dose is very small. So often that's a very effective form just for the 2, 3, 4 years that a woman might need it around the time of the perimenopause or menopause.
And what about contraception for men? We never talk about it. Are there any effective ways for them to use?
I suppose condoms is the only thing that I can think of. And obviously having a vasectomy.
Okay.
Yeah, so if they're sure they've completed their families, then many men will go for a vasectomy.
Or taking a testosterone supplement.
Or taking a testosterone supplement. I mean, you can't guarantee that is going to stop them producing sperm, but it does reduce testicular size. It will have an effect on sperm production. It can cause infertility, but I don't think that you could use it as an effective, reliable form of contraception.
That makes sense. Also, I'd like to understand more your take on perimenopause weight gain.
Mm-hmm.
I get asked so many questions on this. Of course, my method has helped many people. I've seen various results for women with intermittent fasting, so I tend to be careful with that because I've seen some people for whom it worked great and others it didn't. And actually I did a video explaining how when we fast, we produce human growth hormone and cortisol, and depending on each person's circumstance, one response might be greater than the other. Mm-hmm. But what is your take and your experience as a woman with that?
So, I mean, the perimenopause, I was going to say, then the perimenopause, it's a tricky time. It's really turbulent. I mean, it's whitewater rafting, isn't it? I mean, the hormones are going up and down in a seemingly very haphazard way. The ovaries are behaving like a loose cannon. Sometimes they'll produce tons of hormones, sometimes not. Our detoxification mechanisms feel as though they're out of kilter. we're often entering the perimenopause at an already quite turbulent phase in our social and home lives. So very often kids are teenagers, we might have elderly parents that are requiring more support, and, you know, we may, as women, have been the shock absorbers of our families and within society, and suddenly we can't take those shocks in the same way. We don't respond in a calm way because our hormones are all over the place. On top of that, we have the added pressure that civilization and our social world creates, which is that we have to be slim, we have to look attractive, we have to be fit and healthy, we have to keep going, we have to be at the top of our game in our jobs. And it's such a pressure. It's such a pressure. Both the internal turmoil that's going on with our hormones and all of the things that are going on outside in our lives increases our cortisol levels. Often women might drink more, so the alcohol will also then have an effect. And again, it can be very subtle. You know, it might just be an extra glass of wine in the evening, but that suddenly doubles what our intake has previously been. And that's, you know, effectively adding calories on that are like a dessert, but they're disturbing our microbiome. So then we're not detoxifying our bodies properly because that's having an effect on the liver as well. And so we're not getting rid of these hormonal metabolites which are in our bodies, and then they're recirculating again. So not only are our own hormones going up and down in terms of what the ovary is producing, but the ones that we're not getting rid of are also recirculating in the system. There's a whole, kind of crisis of things that's going on at this time in our lives, and we're trying to sort our weight out. So I think, number one is again finding the way to love ourselves, in this terrible time of turmoil, and to turn down the volume on some of the external stuff, to lean into our family or the people that are supporting us to help us, to lean into our friends as well, for that too, and to look at food. And intermittent fasting can be a very helpful way of trying to keep the weight down, but also trying to do it in tune with our hormones. So if we're still having cycles, then to think about when the best time for introducing intermittent fasting, for example, might be. Certainly in the first 10 days before we ovulate, when the hormones are low, that's a good time to fast. Estrogen loves us fasting. And then after the first 10 days, the hormones tend to begin to climb. So we have the beginning of a rise of estrogen, a little rise in progesterone, and a little bit of a rise in testosterone. And then we might ovulate. That tends to be, what some people have described as a sort of manifestation phase. It's a phase that's not so good to fast in, but often we have a little bit more strength and a bit more energy at that time. So it's a good time to do things. And then we have another little dip in hormones, so that can be a good time to fast again. And then we have a rise in progesterone, quite a big rise in progesterone. And progesterone doesn't like fasting. It's a hormone that likes us to run a little bit higher on carbohydrates. So when we're getting to the pre-period week, that's often a period of time to perhaps be, just have an overnight fast, just your 12 hours, just standard overnight fast, rather than thinking about fasting for a longer period of time. The sorts of foods, for example, suggest to people at different times of the month, would vary. So they might have more starchy root vegetables at the end of the cycle before the period, and in the first phase they might have more things that are not root vegetables, so broccoli, cruciferous vegetables, salads, those sorts of things at the beginning of the cycle. Maybe nuts, seeds, soy, things that are pumpkin seeds, for example, things that are going to give them more phytoestrogens and help the estrogen production at that stage. So again, it's very individual, it changes, and that's why it's very good to speak to a professional about it. And it's so difficult to give generalised advice when, everything is so individual. It depends on the stage that you're at, what you're going through, all the other parts of your life. And so one needs to check in. What may have worked before suddenly doesn't work. It doesn't mean that what you were doing was wrong. It just means the landscape has changed. And what we can do in functional medicine is that we very often check women's hormones, both in the blood and in the urine. And we can monitor what's going on. And we can reduce doses very quickly if women are on HRT, for example, bioidentical hormones. We can reduce that very, very easily or increase it.
And do things stabilize after the menopause? Does the weight gain stabilize? How does it work? So you have this period, the perimenopause, where everything is all over the place. But afterwards, once women stop menstruating, does everything go calmer? And it's the peace after the storm, the calm after
So in the main, yes. In the main, there is light at the end of the tunnel. And the turbulence of hormones does settle down as the ovaries pretty much stop producing hormones. But for some women, they do experience night sweats or disturbed sleep or anxiety for long periods of time. And so we just have to travel, with our patients and just see how things are. But I think it's good to get into better habits generally, if you can, during the perimenopausal phase, because it will set you up in a positive way for what's to come later on. And I think you feel much more in control of your health if you make those adjustments. When everything's in turmoil anyway, sometimes it just gives you some sense of control. Things like trying to do a bit of strength training, trying to reduce your alcohol, making sure you're going out for a walk, take the dog out if you've got one, maybe doing a cold water plunge or a cold shower, simple things that might just help. Perhaps paying a bit more attention to circadian rhythm. So, for example, when it gets light in the morning, make sure that you're exposed to that light. Try and get out in the middle of the day if you can. Take a break from work, go for a walk. And then in the evenings, just if you can, again, bathe in that dusk light. Try not to have too much stimulation from your iPhone or your iPad an hour before you go to sleep. Try not to have that second glass of alcohol before you go to bed. You think it's going to help you, and then you wake up at 2, 3 a.m. when your liver's detoxifying and you can't sleep, and it compounds the night sweats. If you can just tweak those little things, it will really help. If you can manage to introduce some intermittent fasting with guidance, I think it's incredibly helpful. And don't expect the landscape to be a variable one. It's not going to all be smooth running throughout the perimenopause. It is going to be turbulent. Be prepared for it. Expect it, even when you might be on hormones as well. Don't think, that's it, it's sorted. It's just the nature of what it is. But there are lots of things out there that can be helpful. Talk to other women, talk to your friends. There's just so many resources out there at the moment that can be helpful.
Yes, absolutely. Of course, eating, enough protein, stabilize blood sugar levels, so we're able to tap into our fat reserves and preserve that muscle mass. Because as we're getting older, we can lose it. And that's why a lot of women are using weight loss injections when they don't have a lot of weight to lose. They might have 5, 6 kilos to lose, and they don't realize how much muscle mass they're losing. And over the age of 35, it becomes very difficult to rebuild it. Harder to build muscle mass than to lose fat.
Absolutely. I mean, I forget what the statistics are, but I think over the age of 50, you're losing sort of 2% of your muscle mass annually, potentially. So it's quite significant. And I agree with you. The GLP-1 agonists, the Ozempics of this world are being used a lot for rapid weight reduction for patients that are not diabetic and not grossly overweight. And the muscle loss is a real problem because it's the main metabolic organ that we have that keeps us healthy, as we go into perimenopause and subsequently. It's interesting, I'm seeing quite a few patients now As Ozempic is being prescribed more and more commonly, not so much. I mean, I do prescribe Ozempic in certain situations, but I see a lot of patients that come to me who are already on it. A whole spectrum of ages of women, from women in their late 20s to, women in their 60s and 70s. And what I notice is that when women are already stressed, their cortisol levels are high, gaining fat around their middles is their security blanket. And when you give them an injection of something that forcibly removes that security blanket, there are health problems that happen as a result of that. So often we see problems with the pancreas, problems with the thyroid, as well as problems with losing muscle further down the line. So I'm really quite surprised and now super cautious about advocating women starting Ozempic without very, very good advice from, someone that really is thinking in the round about their total health going forward. They will lose weight. There's no doubt they will lose weight. But these ongoing health problems are of real concern. You can give yourself a disease in the quest for this rapid weight loss. It's just not worth it.
Wow. And what kind of thyroid issues do they develop?
All sorts of things. So it can become an underactive or an overactive thyroid in very rare cases, thyroid cancer. But again, it's really important to take a very, very detailed history, see if there's anything in the family. But all of these things, they are drugs. They are drugs. Okay, they are hormones, they're peptides. But we just have to really be cautious about when we're prescribing them and how long we're prescribing them for, and making sure that they're not replacing good, healthy practices, i.e. doing the right type of exercise, looking at the stress and what's causing it, looking at our nutrition, thinking about intermittent fasting, exploring all of those things, how much alcohol we're drinking, all the common things. I mean, it feels terribly unsexy sometimes to talk about all of those things, but it's true.
Yeah. That's the reality. My gut feeling, and I want to ask you this because, of course, I have no proof of that, but my gut feeling was that if someone takes Ozempic or any diabetes drug, if they were to stop it, they might become less insulin sensitive and increase their insulin resistance, and also with less muscle mass will be burning less calories. Their basal metabolic rate is going down. Is that correct? Would someone who uses Ozempic to lose 3, 4, 5, 6, 10 kilos and is not morbidly obese, at some point they might want to stop because of the side effects? They're feeling digestive upset and they're not feeling 100%. Will they gain more weight on the back of it after stopping because of all these things?
Weight regain is very common on stopping Ozempic and often overshoots the mark. Patients end up being heavier than they were before they started it. And you're right that a large proportion of that is because of the muscle mass they've lost. They've lost the ability, not entirely, but they've reduced their ability to balance their blood glucose because they've got less muscle to do that. Develops the insulin resistance, and then the weight goes on. So, you're correct in that.
So for all our listeners, the reason why when you have more muscle mass, you have more stable blood sugar levels is because sugar gets stored in the muscles as glycogen. So the more muscle you have, when you're eating carbohydrates, some of that sugar you'll be consuming will go and get stored in your muscles, and the rest will be in your blood, and you will be using it for energy. So if you have less muscle mass, whenever you're eating carbohydrates, the majority of the sugar will be circulating in your blood instead of being stored as glycogen in your muscles, and as a result you're going to have to produce more insulin, which is going to store that sugar, transform it, simplifying it, in simplifying the process and storing it as fat around the body.
Absolutely. So any energy consumed that is converted into glucose in the blood is rapidly pushed into cells by insulin. Whatever the cells can't cope with, that is surplus to requirements, becomes stored as fat. And that can be fat within the muscles, fat within the liver, fat around the middle, fat. Wherever there's a place to store fat, you will get extra fat. Yeah.
Thank you so much for explaining all of this. It's fascinating. I mean, we could carry on talking for hours. But the bottom line is, don't go and self-prescribe Ozempic. Go and see a doctor. Have your measurement taken. I have had incredible success stories on the platform. People who lost 20, 30, 40, 60 pounds of body weight by following an anti-inflammatory lifestyle over a year and a half. And the body has weight memory. So when we lose the weight slower, we are more likely to stabilize it, consolidate it, and maintain it. So rapid weight loss is less likely to be stabilized than slow, sustainable weight loss.
I think the other thing as well in this is the effect on the thyroid, because your thyroid gland is what affects your rate of metabolism. So when you're losing weight, the thyroid gland tends to reduce the amount of thyroxine it's producing. And when the thyroid gland has reduced the amount that it's producing, if you then start eating and everything again, you then end up putting on weight because you've effectively, from a functional point of view, become slightly underactive.
And reduced your metabolism. That's
exactly.
why extreme calorie restriction over a short amount of time will reduce your metabolism, and that's why people experience rapid weight gain on the back of it.
Yeah.
So take your time, get educated. There is effectively no shortcut to health. It's boring, but it's true.
It's boring, but it's true. But it works if you stick with it.
It works. And what's amazing with consistency is you don't notice it because there are incremental improvements and changes. You don't notice it yourself. But when you look back at pictures, myself, I'm 45 now. When I look at pictures of when I was 35 in a bathing suit, I have so much more muscle mass now than then. And I'm 10 years older. All I've been doing is my little workouts that I share on the platform. It's 20 to 30 minutes a day. I never do more than 5 times a week, generally more around 3 to 4 times a week. But this consistency has paid off.
Absolutely. And that's the thing. And I think it's so important for women and men not to lose heart. It's so easy to think, things are not happening quickly enough. But the consistency really, really pays off. Totally agree with what you said there, yeah.
Nikki, thank you so much.
Thank you very much.
It's been so insightful. I'm sure our listeners have loved every bit of it as much as I have. So people can find you at the Lancerhof Clinic in London?
Indeed, yes.
Wonderful. And I will be linking the website and everything. So if people want to come, get tested and see you, they will know where to find you.
With pleasure.
Thank you so much to all of you for joining. Thank you, Nikki, for being with us today.
Thank you again.
Thank you so much to all of you for listening to this podcast today. I hope you enjoyed it. It's always such a pleasure to talk about health because it's not about the destination, it's about the journey. Looking after our health is a daily thing, just like brushing our teeth. We've got to focus on it, we've got to do it right so we can live better and happier lives. For those of you who are not members of the platform yet, we have a discount code for all our podcast listeners. You can get 15% off the memberships. Just enter the code podcast15 at checkout. Thank you, and make sure to read all the articles and all the free content we have on eatburnsleep.com to keep you motivated and informed and educated about living an anti-inflammatory lifestyle.